Welcome back, welcome back. Well, I've been telling you, health segments, it's always something that people are eager to find out more about. And I've got one for you right now. You're about to see something quite unique. And our CEO is here of Parc Diagnostics. Now, PARC, many of you would actually see the advertisements in the newspapers. The famous Parc Man for men with erectile dysfunction. We understand it's one of the most powerful products that you could possibly use. I don't personally need it myself. However, Parc Diagnostics Limited is now offering something where it's less invasive. As a matter of fact, I think I've said enough. Let me let the CEO say all that he has. Candice Chennaikan, of course, is here. How are you, sir?
I'm very well, thank you.
It's great to have you. It's great to have you. And are we saying that Parc Man, just very quickly on what one would describe as a humorous note, is probably the most powerful thing to make you stand up like a man?
Well, the best thing I can say about that is the men of Trinidad and Tobago knows this. That's why we're the #1 male enhanced in the country, but that's not the reason why I'm here. And besides the Parkman,
right.
Parc Distributors really started off in the supplement business about 15 years ago.
Right. These are vitamin supplements, etc.
With a formula called alcoxyrol. It's a shark liver oil capsule that is based on building the immune system.
Right.
So the shark liver oil capsule, you take that 1-3 times a day, and it fights cancer, arthritis, diabetes, lupus, psoriasis. We've had many people over the years still alive and reduce the side effects significantly by taking alcoxyrol, because the AKG content, it reduces the side effects of chemotherapy.
Right.
So our first entry into the supplement field was alcoxyrol, which Trinidad and Tobago would know us for.
Right.
And then came the Parkman. But in the last 2 years, our company have gone into diagnostics, which is a natural evolution of the company.
Right.
So with my trip to Russia, we spent 6 weeks in Russia, and it's a miracle that we have the technology here today, which we want to talk about.
Now, let's talk a little bit about what you're doing. What kind of service are you offering with Parc Diagnostics?
Parc Diagnostics has 2 basic services. One is a whole body scan, where in 5 to 7 minutes, Hansley, we can actually tell you anything that is wrong with your body without asking any questions. And I hope today that you're going to have a volunteer. So on the air...
We got a volunteer.
We have a volunteer.
Here
Very
this
nice.
morning.
So we can put somebody on the air, on the spot, and all Candice will do is ask them their age, and we will read their bioactive points. Now the bioactive points, we get the energy, electrodermal resistance, and we can monitor the health of the organ. Now the Japanese, the Soviets, and the Chinese have collaborated for this technology, and it's in use for over 30 years.
So this is non-invasive. This is not about taking blood or anything of the sort.
Well, it's completely non-invasive, and what is more important is that it's an excellent pre-screening tool. Sometimes you have people who are unable to determine what is wrong with them.
Right.
And they go through a series of medical testings, which are expensive and takes time.
Right.
We can have this test done with this person in 5 minutes. They can take the report back to the doctor. And why I say back to the doctor, a lot of times holistic companies, they approach and people think that it's against conventional medicine.
Right.
Our system was able to marry both Eastern and Western medicine.
Right.
So we have research doctors that are literally trained by Western sciences. Our consultant is based in South Florida. He's a biophysicist.
Right.
And all the technology that we've brought back here is first screened by this executive team. So with our program, we can read the energy that passes through your organs, which the Chinese call acupuncture points or meridians.
Right.
And with this information, we send this reading back into a database with approximately, we're right now around 2 million medical records.
Right.
And while we in Trinidad and Tobago don't know about this, can you imagine that in 1979, this Russian team was in Cuba, and they actually spent 1 month testing this device on people of our type of ethnicity.
Right.
So hence the reason that you have a system where it's not only based on Eastern or European people or Caucasian, but we also have African, Afro-American, and Latin American people.
Yeah.
Right? And this was done back in 1979. So this is how long ago.
So the technology is old,
yes, absolutely.
but it's new to Trinidad and Tobago.
Yes, sir. Yes.
No, obviously, it's going to tell you what's wrong with you, and then from there, you decide to take, if there is something, if something is found, you all can make recommendations as well to say, well, okay, you can go in this direction, you're free to see your own GP, your general practitioner, etc.
Well, you know, this is the best thing about it. Because it's based on science, we can have an intelligent report where a doctor can take and then say what is the conditions. For example, Candace, when you've been doing tests, because we've been doing tests for the last 6 months, Candace will tell you what are the 3 areas that we have found from our tests of the population to have come up the most.
Well, ideally, one of the main target areas that we've seen is with the digestive system. A lot of the people we see screening, they have these busy schedules, so they realize that they're not eating on time, or they're skipping meals that are not intentional on their part. And when we do the screening, they have all these bacteria in their stomach.
Wow.
And that bacteria is giving rise to all these other clinical symptoms, cramping and discomfort and such. And basically, that bacteria tends to feast on all that acid building up in your system.
Right.
And that once you skip that meal or you don't eat on time, that acid builds up. And you have this bacteria, Helicobacter pylori, in your system initially. That helps with digestion. So when that acid tends to fluctuate with past the normal ranges, that bacteria will now be beyond the normal borders, and that's what will give them that clinical symptoms. And they experience weakness, sometimes tiredness, sometimes they can't go on with their day, and they're trying to figure out, well, what's going on with me? And that simple thing of skipping a meal is what's causing that.
So that's a danger, but does it also say that the health of the digestive system, or as we say, the alimentary canal,
that's right,
is critical to general health?
Yes, because what it's saying is that, remember, your digestive system is not just your stomach. You have your small intestines, your large intestines, your colon. So that bacteria will not just be present in your stomach, but throughout the entire digestive system itself. Sometimes some clients, they see inflammation in their pancreas. Any abnormality in your pancreas would fluctuate your blood sugar levels.
Yeah, that's
You
right.
get symptoms in your liver. Having fatty deposits around that organ could raise your cholesterol. So ideally, that small thing of that bacteria populating the entire system, it hinders all other processes that are linked to the digestive system.
And that's linked to the disease. It's one of the things that a lot of people don't want you to know.
Yes.
Exactly.
Yes.
A lot of people don't want you to know. Well, we're going to do a demonstration, but let me ask you, where are you guys located? How can you be contacted? We're going to put the number up on the screen. I hope Indira took the number. And we'll just put the address one more time.
We're at 63 Carlos Street in Woodbrook on a Wednesday and Saturday.
That's opposite
the Brooklyn Bar.
Most famous bar. Boise Singh used to drink there.
Well, he was a long time before my
Yeah, a long time before. But that's the landmark, the Brooklyn Bar.
Yeah, and we recently opened in Chaguanas and Ramsing's Plaza 2 weeks ago.
Okay, all right.
So we're there on Tuesday through Saturday.
Right.
At Ramsing's Plaza. And we're in Tunapuna, opposite the Tunapuna Regional Corporation.
Okay, that's easy to find.
Right.
That's just across the road.
Yes. So we're operating from these locations.
I think the library is somewhere around there.
I think
there's a court.
it's right in front of the
Right. Okay.
The Port of Spain taxi stand.
Right, okay.
Ramsing's Plaza.
All right, Ramsing's Plaza, and of course, Tunapuna is
opposite the Regional Corporation.
Regional Corporation building. Okay,
and
so
Woodbrook opposite the Brooklyn Bar.
All right.
And our telephone number is 222-6177.
All right. Did she put it up? Did she actually take the number 222-6177? If we can put that up, 222-6177. Now we're going to take a little break, and then we're going to get a demonstration on how this actually works. Before we take the break, is there anything you want to add?
Well, one of the things I want to say is this. The EMD is an approach to health, to taking charge of your health.
Right.
So it's not about when you have a sickness, come and do a test. What about if you're healthy? What if you have a family of cancer history or heart disease
and you don't
or diabetes and you don't know because you don't experience these symptoms?
And very often it's too late.
So what we're saying is be proactive. Trinidad and Tobago, be proactive. Be proactive about your health. Take a test and we can see trends.
Right.
We can see your body changing. So we can tell you, Hansley, you're around 50 to 60% deviation from normal.
Right.
We need to look at this. Maybe you need to drink more water. Maybe there's diabetes beginning to show up here, or cholesterol or problem, and you can change it.
Right.
A lot of the problems we experience are lifestyle diseases.
Would you say it's reversible?
Absolutely. Absolutely. And yes.
But doctors tell you it's not.
Well, I mean, not every medical condition is totally reversible. I mean, sometimes it requires surgery, it requires change in lifestyle or medication.
But I agree with you on that point. Dr. Rambertson was telling me that recently he's changed his lifestyle. He's doing things differently, exercising and eating differently. And he says he's reversing a lot of things that he was actually, and he says it's reversing. There are people who are telling me now, who are diabetics, who are saying that they're coming off their tablets.
Yes.
simply because they don't need it anymore, because they've incorporated not only diet, but a strong exercise regimen.
Yes.
And you're saying this could be found.
Yeah, they realize it's that simple to do these little changes in your daily activities instead of taking bags and bags of medication that you're prescribed on a daily basis.
And it kills you faster.
Definitely.
Kills you faster.
Well, if you read any ad on television for conventional drugs, it scares me. Because you're taking one drug for one disease.
Committing suicide. You're
getting symptoms for 5 other diseases.
Yeah.
But you asked a question earlier, which I didn't get to address. Yes, we do have supplements. We do have all natural supplements that can cleanse the colon, that are liquid formulated by a herbalist from Jamaica. All natural. We have stuff to fight sugar and diabetes. Our alcoxyl supplement has been used for many, many years by people to reduce their insulin and to reduce their diabetic medication. But of course, you have to change your life. So don't just take the drugs and eat all the roti and then sit down and be a couch potato. You have to exercise. You have to make those changes. And yes, you can reverse disease.
Yes, we can. We'll be right back after this. Please stay with us. Candice is going to do a demonstration of this, and you'll see how it works. And we'll find out all the things wrong with our guinea pig when we come back. Please stay with us. Fantastic. Okay, welcome back. Welcome back. Mr. Narayan Singh of Win Communications is here, and he's has agreed to be our patient today. Now, Candice, can you tell us what you just did? We didn't see it, but there was some preparation going on. First of all, you have to type their name in.
Right. So we enter patient information, first name, last name, date of birth. Sex, male, female.
And or other.
Or other.
Yeah.
So what we do is we prep the areas where you'll be screening the meridian points located at the wrist.
Meridian points are on just below the wrist.
Just below the wrist.
Where you get the pulse.
That's right. And certain areas here, the meridian exactly is connected directly to the organ. So what we'll be doing is measuring the electrical resistance at each point. Right. So they're located at the hands and at the feet. So
at the base of the feet.
Just at some of the joints by the ankles, by a couple of the toes. And then what the device will do is, as we swipe each area, the device will then compile that information based on the electrical activity at that point. Now, while you're screening, the operator can't be touching the person's hand because I'll be transferring my energy onto him, and we don't want to conflict with that. Now, the tip of the device has some saline on it. Saline will help with the electrical conduction for the device.
Yeah, because it's a concentrated solution.
That's right.
And electrolysis, concentrated solutions are the best liquid conductors. Am I correct?
You know your science.
I am a science student. I was indeed, yes. All right, so...
So we just put that saline at the tip of it.
Right, at the tip of the thing,
And he'll be holding... This is like a conductor just there to like ground off that electrical activity. So he's going to clench around that for me. That sensor.
You probably could zoom in, go on a 2 now if you like.
Keep it clenched.
You all could go on a 2 if you like, so that you could see what's going on. All
right, so then we just simply start the test. And you're holding this hand open for me.
So let's go. We're going in closer now. It's as simple as that.
Turn over your hand for me.
Are you getting readings?
Yes, we are.
Is he half dead?
We won't know until we're finished.
And you're checking the feet now?
That's right. Each meridian point, like I said, a combination will give you different readings for particular organs.
We didn't want to show his toes, but... So you're checking around his ankles?
That's right.
And his instep as well?
A particular part just between the instep. Turn this hand over for me.
I'm almost scared to use this thing.
Turn over your hand for me.
Wow. Mr. Singh, I hope you're in good shape.
Oh, we're not right now.
Right, and then with a simple internet connection, the device itself would send the report to our international server.
Right.
It'll compare the data that we compiled to that database that we already have.
Right.
And then it will generate the report.
All right. So how long does the report take to get?
Report takes, it's already finished.
It's finished?
Yes, it is.
Is just that quick?
It's that quick, couple seconds.
Wow. All right. What exactly is it saying now?
So I could put on my shoes and socks now back?
You can put
You could put back on. Yeah. Let's find out
Only
how
one
far you.
complaint on that thing is ticklish.
Yeah.
Well, for those who have sensitive
But the
feet-
beauty of it is non-invasive, you know,
That's right.
and that I like. You know, them taking blood because I faint whenever they take blood from me. I'm squeamish.
Okay.
Yeah. So all right. So
You have me on squeegee in my socks too?
yeah. No, that's all right. So let's see.
So-
What is it saying?
Basically, what it does is we get different versions of the report. The first page that we have, it will highlight the energy levels for each organ with those meridian points.
And what are the energy levels saying?
Where they're within the range, at first glance, he has a lot of them within the good and normal ranges. We just have one or two areas that are a little weak and probably one or two areas that are a little abnormal in higher perspective. So what we're looking at is percentages.
I realize you don't want to give away anything. You don't want to give away his medical report.
Percentages are basically what we look at as a guide. So anything 50% and below, we say
How
is
is his
good and
heart?
normal. His heart, his cardiovascular system is at 43%. So
Oh my.
ideally, he's within okay ranges for that one for his age. Anything above 50% going closer to 100, we say is weak and abnormal. So what it does is it highlights four main systems that have the highest percentages, and then the four major organs that are incorporated with those abnormalities. So from what we're seeing here, his number one system that's abnormal is his metabolism. His metabolism is currently at 85%. Now,
Wow.
basically,
That's high.
that's high. So what we're saying is that when we talk metabolism, we talk about how your body is producing energy from the food that you're eating on a daily basis. So at 85%, you have something called manifested asthenia. That's what we call your body's natural feeling of tiredness and fatigue, basically because your body isn't reabsorbing enough energy from the food that you're eating. So if it's actually doing something and all of a sudden you just feel as though you can't carry on the rest of the project or whatever it is you're doing, your body itself is feeling so tired. It's because it doesn't have enough energy from the food that you're eating.
Right.
Right? And the next system that was highlighted was your endocrine system. Your endocrine system is your hormone production system. Now, what it's saying here is healthy. So that number one area that was highlighted for us, 85%, that was the highest percentage in your system. What the system would do is, even though the rest of the systems are within good and normal ranges, it'll still pinpoint those that are going towards the 50% margin. So you keep looking at it. So you based all your information that you're saying, okay, if it pinpointed your endocrine system and the next one is your digestive system and the other one was your musculoskeletal system, they're in the 30s and the 40s. So what you would do now is, when we're going through the individual organs, we would say, okay, you're that close to the 50% margin will give you like some clinical symptoms that could be telltale signs that it's starting to cross that border to go into the weak area.
Right.
So you can now manage that better by just knowing, okay, well...
What is the organ saying?
That's right. So his organs, the number one organ that was highlighted was his liver. It's at 82%. When was the last time
Oof.
you checked your blood cholesterol?
Wow.
About a year and something.
And how was it?
It was high.
Marginally high, right? Because your liver is at 82%. So it's saying that there's a high chance that it's still high, and ideally you'll get complaints like fatigue and weakness and discomfort in your upper right quadrant of your chest area. Now, high cholesterol, we know, is one of the factors that could contribute to cardiovascular problems. So anything highlighted with cholesterol, we try and advise our patients that it's it's very, very important that you manage this as best as you can.
Right. What about the pancreas and that sort of thing?
We're looking at the pancreas. His pancreas is the number 4 organ that was highlighted, 58%. So your pancreas is a little inflamed, right? Ideally, that would have a tendency to fluctuate your blood sugar. When's the last time you checked your blood sugar?
This morning.
And how was it?
High.
Right. So it's highlighting that as well. So ideally, with the pancreas and your gallbladder, we call them your silent organs, because most of the times you don't get really clinical symptoms to highlight anything's going wrong there.
Right.
So that's one of the good things about the system is that silent organs, you can now highlighted abnormalities there. So when you're not really feeling any symptoms, that will highlight, okay, well, maybe it's my pancreas. You won't just feel it's your pancreas. Now you would know without even voicing it. The organs can't speak for themselves.
Right.
So you're able to know that now.
Yeah. Wow. Have all these things been told to you by your doctor?
Some, not.
Yeah, okay. All right. Oh boy, this is scary. I won't even try this.
Your number 2 organ is your gallbladder. Like I said, it's one of the silent organs, right? So what we look at is dysmotility of your sphincter apparatus. Basically, you find discomfort in your upper right hypochondrium. You'll have like a bitter taste in your mouth. If you have any unstable bowel movements. Your gallbladder is one of the organs that are part of your digestive system. Mm-hmm. Your gallbladder is something like your kidneys when it comes to toxins building up in it. You'll have like sand and gallstones building up, and it's a little more tricky for you to pass out gallstones and stuff in those areas. It's not just as simple with the kidneys where you take medication and you pass it out while you're urinating and stuff like that. So ideally your gallbladder, sometimes it's linked to dermatitis changes, skin pigmentation changes and stuff like that. We've had 1 or 2 clients who have come in where they don't know what's going on with their skin. They're having these pigment changes. Mm-hmm. And when we check the gallbladder is at the 90s.
Wow.
So they ideally go with the report. They have an ultrasound done on the gallbladder. You check and see if you have toxins building up, if you have gallstones building up in that area of the organ.
So how is my gallbladder reading?
What's your gallbladder?
Your gallbladder is currently reading at 63%.
Oh my God, that's high.
All right, so ideally you're within that range where it's saying the recommendation is that you should consult a gastroenterologist so that you can go about getting an ultrasound done, looking at the gallbladder itself to make sure that the toxins are...
I want to open up, Candace, the telephone lines, if I may, for questions from the general public. This is for you, 665-6278. I'll open up the telephone lines right now. You could talk to Candace and find out a little bit more. Now, can you guys, when your CEO was telling me that you can offer a solution to when you start discovering these kind of problems.
Definitely.
In addition to products, a diet recommendation, a health chart, are these services that you also offer?
Well, ideally what we do according to what the abnormality is, we don't want to play doctor and make an arrangement and tell you, well, do this, don't go and see a practitioner.
Right.
We advise that we're in no way trying to replace a doctor's diagnosis in any way.
Right.
But if it's something that ideally can be changed by taking a certain supplement, because some of our patients who come in, their immune system is abnormal, and with the chikungunya and the dengue virus going around, that's one of the systems that will be highly abnormalized these days. Your immune system, your white blood cells, they won't be able to help your body fight off any other infections, any kind of bacteria that's entering your system.
Right.
So you'll find yourself susceptible to get the flu and all that easier.
We're swamped with calls. So
Okay.
we've got to go to them now. Let's take these calls. Hello, good morning. Hello, good morning.
Morning, Harvey.
I'm not hearing...
Morning.
Yeah, hold on, sir. Hold on. The box is off. Hello. Yeah, go ahead, please.
Yeah, morning.
Morning, sir.
Yeah, I look at the demonstration there.
Yeah.
What is the cost of this?
Yeah. What's the cost? Very good question.
Ideally, it's individually priced at $350. But
TT?
That's right. So, and we have group rates. So if you're coming with family members, we give you it for $250 each. So it's very cost effective. It's very cost effective.
Well, it's nothing.
Hold on there, please.
All right.
I have no problem, no health, nothing.
You have no health?
Nothing, no ailment.
Sure you're alive? All right. Okay, so the telephone numbers, please, if we could just put up the contact numbers for them. That's a great service that you're offering. Let's take this other caller. Hello, good morning.
Morning to you, Hansme, and to the panel.
Morning.
Hi, good morning.
I'm very impressed. The medical demonstration there, and I'm really interested in doing one because, like yourself, I'm scared of giving blood.
Right.
And I'm hoping that you all the enough strength of the gentleman there too.
You're from Shigwanas, are you?
Yes.
Right, okay, great. It's at Ramsing's Plaza, and you know, can you give us the proper address, Ramsing's Plaza?
It's directly opposite Mid-Center Mall, the same building with Papa John's. So we're located on the ground floor. You can call us 222-6177 and we can book an appointment, ideally on the same day, if not 24 hours.
Yeah.
Okay, that sounds great.
All right, fantastic. Thank you. More calls, 665-6278. Hello, good morning. Hello. Good morning. Hello. All right, let's take this other caller. Hello, good morning.
Hello, good morning.
Morning, sir. Good morning.
You said something just now that I would like to further details on it. Is that you said that high cholesterol will show up a high percentage in the test in your liver. I did a test of my liver. I had a fatty liver, but my cholesterol levels were low. Right. So could you further elaborate on that, please? Thank you.
Ideally, what the report says, it will have a tendency to raise your cholesterol.
Right.
I'm not saying ideally fatty acids would raise your cholesterol. It'll have a tendency because fats in itself would, they're high in, well, if it's that they're not saturated fats, your body itself, the fatty deposits would be hindering the liver in itself.
Right.
So the liver itself is one of the organs that help to break down those cholesterol deposits present in the body.
Right.
So if it's that you have fatty deposits around the organ, obviously that process itself is going to be hindered a little bit. So it will have a tendency to raise your cholesterol.
Right, okay, makes sense. 665-6278, 665-6278. Hello, good morning. Good morning.
Hi, good morning. Can this test do show cancer?
Okay, that's a very good question. Can it show cancer?
When we look at the mammary glands and our female patients with regard to any indication of breast cancer, what the report will do, it'll indicate a probability of you having a buildup of cells in a certain area. So what it'll do, it'll pinpoint that. It will actually show you an image of the mammary glands or the breast, and then it will say, well, the percentage is that amount of tendency for there to be a buildup of cells in that area. So then it will recommend you go and see your general practitioner and do a screening to confirm it.
Can it see cancer cells in other parts of the body?
Ideally, yes, it would pinpoint if it's that it's picking up on that mass in that particular area.
Has it picked up anything on him?
No, not that I can see. What we look at in our male clients is ideally prostate cancer.
Right.
So what it'll do, when we look at the reproductive system, it'll highlight the prostate. It'll let us know if there's any.
But you get it from just doing that, as opposed to
because the
shooting the prostate.
The meridian points, ideally, there are one or two that are connected to your reproductive system.
Right.
So when it gives us that initial evaluation, we ask, well, ideally, doing a prostate exam is something that practitioners would say it's good that you do if every year, every other year, just to keep evaluating once you have any family history of it.
Right.
And cancer is something that you can't predict, right? And it sneaks up on some people. So if it's that the system could highlight there's a probability of you having it, you ideally get that checked out immediately. Once you get cancer checked out in very early stages, treatment is better off, yeah.
This is great stuff. It's non-invasive. Folks, I want to thank you all very much for coming in and giving us this demonstration. And this is something that I'm actually scared to try. But can I have, can you just pass this for me here? Take a look at what this device looks like. This is intimidating all by itself, as a matter of fact. All right, ladies and gentlemen, it's time for us to say goodbye. My name is Bond, James Bond. And we want to thank all our guests this morning, Dinesh, Sankar Singh, Ms. Tukana, and of course the folks at Park Diagnostics Limited. The number is up on your screen. And Mr. Narayan Singh for volunteering. Thank you ever so much, Mr. Giles Wilson, our director, Vikas Ardeo, our audio man, our cameraman, Joshua Lewis, Kiran McDowell, our master control manager, Bhavita Gopalchan for bringing us the news, and of course, Indira Dukran for producing this show. I'm Hansley Ajoda. I'll be finding out what's wrong with me in just a bit. You know, Shadow made a song called What's Wrong With Me. Yeah. So
Nothing
I'll
is
play
wrong
that in
with
the
me
background while it's going on. Thanks again. Thanks. Park Diagnostics, you got their number, you got their addresses, and check them out. Take care. See you tomorrow.